Segment. We're with Dr. Mark Moran. And Dr. Moran, first of all, thank you for joining us.
It's a pleasure, Art.
I know we're going to be talking about laser vision correction. And before we do that, though, could you kind of tell us a little bit about your office here? Because you have an office with a lot of talented people in it. And tell us a little about it and where it's located.
Well, the office has been here quite some time. Actually, Dr. Trachtenberg, as I think mentioned earlier, or was it later, we had heard him mention, that he's been in practice 26 years. At this location, though, we've been about 15 years. And the location is at 1739 Fairmont Street. That's in Allentown, and you can call the office for directions, of course, but we're right off the 15th Street exit. In fact, we've got 22 behind us as we look out there.
It's a very easy access, and I know that as we talk about this, when I walk in here, I'm impressed, first of all, with the colors. Everything looks great. But you handle people, a lot of people, and you do it very professionally. I know that laser vision correction is your specialty. You know, what exactly is, laser vision correction?
Well, that's actually a pretty broad question. Laser vision correction is multiple things. But the basic general concept behind it is we take patients that have refractive errors, the need for glasses or contact lenses, and what we do is we use a laser to remove that need and to free them of glasses and contact lenses as best we can.
Who would be the candidate? I mean, how do you know who that would be?
Well, that's actually another pretty tough question. I mean, the best candidate for it is multiple of things that have to come into place. I mean, it's not only what they expect from the surgery, but the physical aspects. I mean, there's a big evaluation that we will put patients through to determine whether they should be having laser vision correction or not. Just because you wear a pair of glasses does not make you a candidate.
As far as nearsightedness, farsightedness, stigmatisms, what are they? How do people know they have it?
Well, nearsightedness and farsightedness are pretty much, most people are kind of associated with that, nearsighted or aware of that. Nearsightedness means you can see up close, and of course farsightedness in turn means you can see in the distance. But a little bit more involved in that. It has to do with where the images are focused on your eye. The image comes in through the front part of your eye, through the cornea, through the lens of your eye, and then it's focused on the retina of your eye. If you're a little bit too short, you're nearsighted, and if the focus is a little bit too far, you're farsighted. Astigmatism has to do with the shape of your eye. If your eye is basketball-shaped, perfectly round, you don't have astigmatism. But if you're more football-shaped, and again, I exaggerate a little bit to give you a mental image of that, but if you're more football-shaped or oblong-shaped, you have astigmatism. And you can actually have combinations of that. You can have nearsightedness and astigmatism, or you can have farsightedness associated with astigmatism.
Yeah, when it comes to farsightedness, what's the difference between farsightedness, and I don't know if I'm going to say this right, but presbyopia?
Presbyopia, it's very good. Actually, presbyopia means old eyes, if you take it apart in the Greek. But what it actually is, it's a process that begins when you're a young child. When you're a young child, you have great focusing ability. You're able to focus up close very easily. Well, as time goes on, and we all hit in the 40s and 45s, that focusing ability starts to drop off and makes it more difficult for us to see up close. Well, that's presbyopia. Now, farsighted, remember they said earlier, was to be able to see in the distance and not be able to see up close. But it has to do with where the image is focused. The presbyopia, again, is the focusing ability. It's quite often a hard concept to grasp and to explain.
The difference between PRK and LASIK?
PRK and LASIK, they're very, very similar. Actually, PRK came to America before LASIK did. We eye doctors are famous for our alphabet soup, but photorefractive keratectomy is so much harder to say than PRK. But the main difference between the two of them are when you take off the top layer of cells or skin of the eye to get down to where you need to treat, it's the method of how we remove that. With PRK, we actually go in and we may actually use the laser itself to remove that top layer of cells and then let it grow back. For LASIK, we may actually use a keratome to help remove that, make a flap, and to apply the laser treatment, and then put back that flap. The difference is, from the patient's point of view, you'll probably heal faster and get quicker recovery with LASIK. The end result with both is pretty much the same. There are some other little differences.
As people watch this, I know my question, and most of them would probably say, how do I know if I'm a good candidate for this? Obviously they need to come to the office, but take us on a little process here, a tour of mentally of how that would happen.
Well, that can be a very long process. And again, it's very important to be a proper candidate for this. Just as patients, when contact lenses became available, not everybody can wear contact lenses. Not everybody can have laser vision correction. We've had patients that have gone through an extensive process to the point where they've been here for 6 months on multiple occasions until all conditions were optimal and until everything was perfect. And then we did their laser, and that turned out to be a much better result. But there will be topographies done, which is basically a measure of the surface of the eye. There'll be a pachymetry done, which is the measure of the thickness of the eye. Those are very, very critical to just whether we can make you a good candidate or you can be a good candidate medically speaking. You'll be evaluated in your work, well, not in your workplace, but what you do, what you want from your vision. Some people's worlds, like accountants, are more up close than people who work in the distance. Those are very critical and very important factors when we're evaluating a patient for LASIK surgery. And you may have the medical categories and have the medical criteria, but maybe it doesn't fit, we can't fit your vision into your world, and you won't be a good candidate for laser surgery.
Well, I think that's great that you go through the extensiveness of all that, because what you're doing is taking a lifestyle of a person in accord with all that you're talking about. That's terrific. Once you have it done, if you are a good candidate, is that a permanent change or something that has to be done more than once?
We've got patients that have, well, personally I don't have patients that long. I mean, it's only been approved by the FDA in the United States over the last 3 or 4 years. But there's patients out there that have had this surgery done 10, 15 years ago, and every indication what they had from day one is basically what they got at year 15. So yes, all indications we would think that would be permanent.
The more you learn about this and the more you hear about people's good experience with it, you think in terms of why wouldn't I have it done, or why shouldn't everyone have it done? Risks, is there any severe risks or anything that people need to know about?
Sure, there's risk. I mean, it is surgery, and one of the things we do here is we make sure we treat it like surgery. If we have a problem, I mean, we want to be able to take care of it, and we've had patients that have had problems. But because they were followed up correctly, they were followed up continuously, those problems were minimized and their result was good. So yeah, it is surgery, and you've got to keep that in mind. So it's something that we treat very seriously in a serious manner, and I probably said seriously 20 times in that last statement, but it is serious to us.
And that's good. I mean, you don't take it lightly. It's not something you're just running through. You're dealing with eyesight. You're dealing with a person's future. Does it hurt?
Well, you have numbing drops. We have special numbing drops for it. I've had patients tell me that they feel a pressure, like somebody pushing their thumb against their eye. But no, there's no pinch. You don't feel a cut, or you don't feel the laser being applied. The worst part that most people complain about is the pressure, and that's minimal at most.
And, how long does it take? You've had the surgery done. I know the surgery itself, how long does that take? But then how long does it take to return to normal afterwards?
Well, again, we treat everybody as an individual, and the reason we treat everybody as an individual is their response is different. The thing about the laser surgery, the laser, what I tell it to do is extremely accurate. If I tell it, we deal in microns, which is thousandths of a millimeter. If I tell it to remove 40 microns, it does 40 microns, but it's the individual and how they respond that makes the difference. So what we need to do, we need to customize things, and we need to go along and basically follow people as an individual. And somebody may be back to work the next day, and somebody may be back to work the next week. Most people don't go much longer than a week, though.
And I guess a question I would have is, did you do both eyes at the same time, or would you do them separately?
We would do both eyes at the same time. In fact, that's become the norm. But when I first started, I basically told patients, I said, you've got to have one eye done at a time. We found now that the procedure is effective enough and safe enough that we can do both eyes at the same time.
How does insurance play into all this?
Well, every insurance is different, and the best way to know it, and I'll tell you the truth, the way insurance rules change daily, the best thing to do is contact our office. We've got a LASIK coordinator that will be able to help you work through that with you, help contact your insurance company, give them the proper information, and get you that information.
I know we've talked about this, but is there financing available?
There is financing available, and that same person can help you with the financing. It does help make it more affordable because it is an expensive procedure. But with the financing and things that we can work out with the LASIK coordinator, it can be very affordable.